Three. Good afternoon. My name is Tera Ifusianitio. Today, our group present an in-depth analysis based on an interview conducted with a parent of a child diagnosed with attention deficit hyperactive disorder or ADHD, which is categorized under learning and neurodevelopmental disability. In Malaysia, children with learning disability are increasingly placed in mainstream classroom through the Ministry of Education inclusive education program. However, despite policy support, earlier detection and parental intervention remain key challenges that directly influence children's classroom participation and academic outcome. Therefore, this presentation aims not only to describe the interview finding, but also to critically analyze how early detection, parental strategy, and collaboration with school influence the learning experience of children with ADHD in Malaysia context. That's all from me, and I will pass the mic to Nasuha.
Okay, thank you, Tera. Now, for this study, we interview Madam Pro, a 35 years old mother and primary caregiver of Hayden Chin, a 6-year-old diagnosed with ADHD. The interview aimed to explore the early detection of ADHD, the intervention strategies employed, and the impact of those strategies on Hayden's academic and social development. Before the interview, we ensure all ethical protocols were followed. Informed consent was obtained, and Madam Pro was fully aware of her voluntary participation and her right to confidentiality. Both her and Hayden's personal details were anonymized to protect their privacy throughout the study. Okay. We employ a semi-structured interview format. This approach allows flexibility in the conversation while ensuring we cover all key research objectives. The semi-structured format also means that we could adapt to the flow of the conversation, allowing Madam Flo to share her experiences in her own words. We began with open-ended questions to make Madam Flo feel at ease and to encourage detailed responses. For example, we asked, can you describe when you first noticed something different in Hayden's behavior? Or what signs led you to seek professional help? Okay. These questions encourage Madam Flo to speak freely, offering insights into experience without feeling restricted. Okay. To gain deeper insight into her experience, we use probing questions. These questions help us dive further into specific details, which is what challenges did you face managing Hayden's behavior at home, and how did the school respond when you raised your concerns? By using probing questions, we ensure that we fully understood the challenges both at home and in the school environment, giving us a complete picture of the intervention process. Okay. An essential part of the interview was our practice of active listening. This included nodding, maintaining eye contact, and offering verbal affirmation like, I understand, or that must have been difficult. And we also controlled our voice tone throughout the interview to maintain a calm, neutral, and empathetic tone. Okay. This helped build trust and made Madam Flo feel comfortable sharing sensitive details. Okay. It's important to mention that we avoid leading questions, which question that might influence the answer or put words in the interviewer's mouth. For example, we didn't ask, did you feel that the school wasn't doing enough to help Hayden? Instead, we frame it neutrally, like, how did the school respond when you raised your concerns? This ensured that we respected Madam Flo's perspective and didn't bias her responses in any way. Being By being mindful of these interview techniques, we created a supportive environment, ensuring that the information shared was genuine and insightful. Our interview approach also aligns with Braun-Freiberger's ecological system theory, which posits that a child's development is shaped by multiple systems such as family and school. Using a semi-structured format allows us to explore this system organically, such as capturing the interaction between Haydn's home life and his experiences at school. This theory helped frame our understanding of how both environments influence his development. Okay. In the conclusion, the combination of open-ended, reflective, and probing questions, along with active listening and empathetic communication, ensure that we gather rich, detailed data. We also ensure that the interview was conducted in a neutral and non-leading manner, giving Madam Claude the space to express her views fully. This approach reflects the outstanding communication criteria in the rubric, as it allows us to collect comprehensive and insightful data that will be analyzed in the following sections of this presentation. That's all for me, and I will pass to the Farah Farhana.
Hi everyone, thank you Nasuha for presenting. So my name is Farah Farhana binti Amir and I will now present the finding related to the early detection of ADHD based on our interview with Madam Chloe, the parents of Hayden Chin. And according to Madam Chloe, early signs of ADHD were first noticed when Hayden was approximately 4 years old. These early indicators include a difficulty sustaining attention, excessive physical movement, impulsive behavior, and a challenge in following instruction, particularly during instruction of activity. So initially, these behaviors were perceived as a typical childhood behavior. This reflects a common misconception among Malaysian parents where learning difficulty are often overlooked during early childhood due to limited awareness and the belief that children will naturally outgrow such as a behavior. So, however, once a hidden entered preschool, the structure, a classroom environment made these difficulties more apparent, and a teacher observed that Hayden struggled to remain seated, has a difficulty and completing the task and was easily distracted during lesson. Teachers' feedback played a critical role in encouraging Madam Chloe to seek a professional assessment, which is eventually lead to a formal diagnosis of ADHD. So from the theoretical perspective, this finding align strongly with Braun-Freiberger's ecological system theory, which emphasized that children development is shaped through the interactions across a multiple system, particularly the family and school environments. In this case, early detection was successful because both of parents and educators collaborate rather than working independently. Critically, this highlights that early identification of a learning disability such as ADHD is not solely dependent on a parental observation of a teacher evaluation alone, but on effective communication and collaboration between home and school. And in the Malaysian inclusive education context, strengthening a parents-teacher partnership is essential to ensure that children receive a timely intervention before academic and behavioral difficulties become more severe. This finding reinforces the importance of early intervention support by a strong home school communication within a Malaysian inclusive education framework. So that's all for my finding. And next, I will pass to the next presentation. Thank you.
Thank you, Farah. So, good morning, good evening, everyone. My name is Siti Nurul Ain with the Halil Azrai. So, today I will present about intervention strategies and the detailed elaboration. After Hayden was formally diagnosed with ADHD, Madam Chloe experienced emotional challenge such as anxiety and uncertainty about her child learning progress. In the Malaysian context, these challenges were intensified by social stigma and limited access to specialized support service, which require parents to be more proactive in supporting their child development. So there's a two intervention strategy, which is home-based and school-based. So look at the first. At home, Madam Chloe implemented structured intervention strategy tailored to Hayden need. One key strategy was the use of a reward chart, where Hayden received star or sticker for completing tasks, following instruction and displaying positive behavior. As you can see on the right of the slide, this reward chart helps motivate Hayden and reinforce desired behavior through positive reinforcement. In addition, a My Day visual schedule was introduced to help Hayden understand and manage his daily routine. As shown on the right of the slide, this visual schedule clearly outlines Hayden activities from morning to evening, allowing him to anticipate transition and reduce frustration. As a result, Hayden was able to stay focused and engage more effectively in learning tasks were also broken into shorter, manageable segments to suit Hayden's attention span, preventing him from feeling overwhelmed and allowing consistent progress. In school, teachers complemented this home-based strategy by implementing inclusive classroom accommodation under Malaysia Inclusive Education Program. Preferential seating simplify instruction and extended time for task completion to her support hidden classroom engagement. So overall, this strategy reflects behaviorist theory through positive reinforcement and Vygotsky's zone of proximal development through guided support and scaffolding. This demonstrates that consistent collaboration between home and school play a crucial role in supporting children with ADHD. So that's all from me. I will pass to the next member, which is Sherry.
Thank you so much, Ain. So, hi and good day, everyone. My name is Shirin Bint Yusuf, and today I will be presenting the impact, critical analysis, and conclusion of our interview study on parental experience in supporting a child with ADHD in Malaysia. So, after consistent home and school-based interventions, Madam Chloe report clear improvements in attention, learning, and behavior. Academical attention show better task completion, improve attention during lesson, and increases classroom engagement. Behavior, there was a reduction in impulsive behavior alongside improvement emotion regulation and confidence with interaction with peers and teachers. So critically, this improvement indicate that effective support for children with ADHD doesn't not rely on a single strategy. Instead, success depends on the consistent and engagement of support between home and school, which support from Brenner ecological system theory when this theory was applied to close collaboration between parents and teachers had ancient experience a more structured and predictable learning environment. As a result, behavior expectations become clear, learning routines were reinforced across setting, and Hayden Chin was better able to transfer positive behavior from home and school. So additionally, the strategy used reflect universe design for learning, which is UDL principles, which promote flexible and differentiated teaching approach to meet diverse learning needs. By adapting instruction methods, Hayden Chin was better support within Malaysia inclusive education framework. However, this study has limitation as it is based on a single parent interview. The finding cannot be general to all Malaysia families, and experience may vary depending on access to support and school readiness. So, in conclusion, the study highlights the importance of early detection, parenting involvement, and strong homeschool collaboration in supporting child with ADHD in inclusive classroom. While policy provide structural support, meaningful inclusion depends on informed parents, supportive teachers, and consistent collaboration to ensure equitable learning opportunities. So, our group 3 want to say thank you for listening our presentation. Thank you.